Hello, everyone, and welcome to today's session Cybersecurity in Healthcare Protecting Patient Data and Medical Systems. I am Shilpa Sharma, and I will be your host for the day. Before we get started, we would like to go over a few house rules for our attendees. The session will be in listen only mode and will last for an hour, out of which last 15 minutes will be dedicated to Q&A. Also, admissions are currently open. For further details about our courses, please visit our website www.eccu.edu. Our speaker for today's session, Ricoh Danielson. Ricoh has extensive experience in handling cyber incident response, cybersecurity, information security, privacy, and compliance. He is a digital forensic expert for criminal and civil cases and has handled cyber incidents for major world-renowned healthcare, financial, and retail firms. Ricoh is a graduate of Thomas Jefferson School of Law, UCLA, and the University of Arizona. He is also a US Army combat veteran. In incident response, he has 10 years of incident response expertise for major newsworthy breaches. Digital forensics, he has 15 years of digital forensics expertise for criminal and civil cases. In legal, he has 15 years representing digital evidence in courts. In media, 5 years as a cybersecurity media expert consultant. Without any further delay, I would hand over the session to you, Ricoh.
Hey, rock and roll, everybody. Good morning or good evening, wherever your time zone is at. I really appreciate the opportunity to present this talk on cybersecurity in healthcare, protecting patient data and also medical devices. And the reason we chose these two areas as we move forward, the biggest paramount thing is we're protecting patients. Remember, our job as cybersecurity professionals is to protect those who can't or won't protect themselves, right? Because we have this badge of honor, right? That says, hey, we are the responsible party. And then that tertiary effect is the medical devices, okay? So again, my name is Ricoh Danielson. I like to keep a very humble perspective that I'm just a cybersecurity professional, okay? I'm an incident responder and I do ransomware negotiation. At the end of the day, it's the biggest thing of understanding the needs of cybersecurity, how we can help each other, and why specifically we're helping each other. And I should definitely update this picture because my arms are not that big, so that's all right. So, all right, so moving forward, guys, so let's just go ahead and jump into this, and we're gonna break these down in a very pragmatic, logical way, right? And I always like to start things off with the point of laughter. If laughter is the best medicine, then why are hackers and threat actors prescribing ransomware, right? It is very, very critically important to understand a few different elements and a few different factors when it comes to protecting our PHI, okay, and our PII, MPI. One thing I used to tell my soldiers in the Army back in the day when we're, fighting combat and whatnot is, if I can't see it, I can't hit it, right? If you don't tell me something, I don't know it. And the best statement and the best phrase a sergeant major, a leader of mine told me was, hey, young man, I don't know what I don't know, and I can't see what I can't see, okay? And it's true when it comes to this. So this is where a good governance person, a good compliance person, someone who's technical, semi-technical, or even non-technical can help us understand the data points, right? And when we talk about data points, we say, hey, the data points are a name, right? An address or a different type of social security or the last four of social security, because even the last four of a social security is protected. Or a GenCIA number, which is a passport number in the Middle East, or a passport number. These are different data points, right? Now, these fall into different data categories, which means, hey, we have a different category here. It falls under this category. It's protected, non-protected, semi-protected. So it all depends on which state. Like, give you an example here. California, they have daddy categories for everybody, everything and everywhere. They even have pet categories as well for data. And that's pretty wild, right? Because my dog's name is Robbie. And if I give him a shot and I live in California, his information is actually protected, which is pretty wild, right? And it's pretty cool. But the same aspect, I'm like, that's pretty interesting. And this actually gives us a connotation of the overall pedigree of what the data is. Because remember this, if you have 5 elements, right, that means you have the 5 elements of PHI, MPI. And at that point, we as cybersecurity professionals have to do the due diligence and the right thing and the needful to ensure that we're protecting not only the data points, but also the data categories. Make sense? The bigger thing is, how do we get to that point of, the key contributing, the key factors, and some of the key things of making sure. And I've always broken down the three things, right? The three B's: budget, buy-in, and bosses. Okay, let's start with the boss, right? Now, the boss is somebody who's above you and says, okay, you need to sell that position to that boss. And you need to tell them, you need to get the buy-in there. So you as a salesperson, saleswoman is going to say, okay, here's my sales proposition, and here's the add value of why we need to have a buy-in. Okay, that means your boss is going to be like, that's a good idea, Rico. We should go over there and buy this tool. We should hire resources and create a platform or process. Okay. Then that goes into the budget part. It says, hey, we need a budget. Like, we need money, right? What does a tool cost? Is it 100,000, 200,000, 300,000? Okay, if it's not a tool, what does a process cost? That means it's labor and people, right? Labor and process. What does a person's cost? What does the salaries cost type deal? So at the end of the day, the three B's are going to be your best factor here to combat and understand the threat actor and the adversary and also the hackers, right? Furthermore, it's going to give you the ability to protect the data points, data categorizations, and the data pedigree overall. I've worked over 1,500 different breaches, and the real cost of a cyber breach is not covered in insurance. Now, what I do recommend is, if you can, in your cybersecurity journeyship and also a cybersecurity career, go work for a cyber insurance, because they're trying to mitigate risk on their side, right, on their investments, right, which is insurance. And then at the same aspect, they're trying to lower the risk and kind of hold people accountable. On the other aspect, if you're a hospital and you get breached and whatnot, and you go to your insurance like, hey, can you help me out? Chances are it may or may not be covered. It depends on what's outlined. So I suggest working on both sides of that desk there to understand the real cost of a cyber breach, okay? So why do hackers, and also more specifically threat actors, love healthcare? If you really think about it, right, it's like a candy store. You have all these medical IoT devices, you have all these, MRI machines, the optical machines, you have knee machines, kidney pumps, and whatnot. And think about that for a second. If you're a cybersecurity professional or an IT person, which I always see just an IT person trying to handle all these things, you have to become affluent and be the expert in everything. Think about that. If you're going to go work for a hospital, it's a good and bad thing, right? Like, you've kind of secured your job. You're like, I'm the security person, IT person, and I know everything and everywhere. The bad thing is you're going to have to know everything and everywhere, right? And hospitals and medicine is always ever changing, and that's a good thing. But that presents the obstacle to us as cybersecurity professionals, saying, okay, if it's always changing, that means I have to always be changing. So we're caught in this juxtapose, if you will. Okay. Now back to the the candy store methodology or the thought process. If you have a cyber, I want you to visualize this, right? If a cyber criminal actor, and in theory, shows up at a hospital and is like, oh wow, this is a lot of good data. What's most valuable to me, right? Right now, we know for a fact that a Social Security sells for about anywhere from 30 cents to $4 on the dark web, right? That means you can charge credit cards, you can have new personalities, you can have multiple lives and whatnot. So Social Security cards are very, very big. The average count of a Social Security numbers in a hospital is about 10,000 to 100,000. So if you do the math, you can actually extort them for a couple of million, 4 or 5, even $40 million, right? Medical charts. Okay, so when we look at medical charts, it is not as valuable as Social Security, but it provides a lot more information, like next of kin, address, and whatnot. And cyber threat actors can actually deduce information from that. They can wreak havoc, they can cause personal injury, they can do a personal extortion. And so these go for a little bit less, anywhere from like 20 cents to $1.50, okay? Billing information is a very, very interesting one in regards to how much these go for. These go for anywhere from like 50 cents all the way to $5. And the reason medical bill information is really critical, because you have addresses, you have different companies, organizations that you're billing to, you have deductibles, you have this and that, the other. And it's pretty wild to understand that the billing information is just as valuable. So the other part is when a threat actor shows up in an environment and says, man, there's a lot of cool stuff in here. And you're visualizing this threat actor just kind of walking into a hospital candy store, and you're like, okay, so there's a lot of wild Jurassic, like a Jurassic Park type deal. Like a lot of stuff is antiquated. You can pretty much push over. Some stuff is not secure. Wi-Fi is not secure. It's wide open. This server over here has no multi-factor authentication. They don't even have credentials. Oh, let me go over here, right? So all these threat actors are always looking for old legacy devices. And if you really think about it, every patch Tuesday, everything prior to that is super legacy. So that means the threat actors always have the competitive edge against us. The last part is on this one is the staff is too busy saving lives, providing medical critical care, and doing stuff like that to notice a phishing email. And the reason we chose and we teased out the phishing email there is because phishing emails happen and still are the point of entry for most breaches. I'm a big firm believer, and I say this tongue in cheek and kind of funny. Is like, all right, guys, you show up on the spot, like Rico's here, I'll help you guys out, but show me the thing that you didn't click on. And they're like, oh, I clicked on this. I'm like, oh, shoot, right? So remember, their job, a medical provider, a doctor, is to do that, which is medical providing, doctor services, medical treatment, right? Their job is not to do phishing. Now, there is some responsibility where they should have some sort of onus, absolutely. But if you really think about it, that's like going to ask a pizza person to work on as a mechanic. Might not be the good fit, or going to a pizza parlor and be like, hey, I want a cheeseburger. All right, so why are you here, right? Same premise applies in hospitals and medical areas. You as a cybersecurity professional, we have this heart, of a teacher. We have this soul that wants to give and protect and whatnot, but just be mindful that a lot of people don't feel the same way. So that means you have to be very mindful of understanding where they are and meet them in the middle. So 80% guys starts with people, clicking on certain different things and suspicious links and whatnot. And it's quite interesting how they've now that we're in the holiday season in the United States, you have Amazon like, hey, I got you a free gift card, right? Or I got you a free cup of coffee. Everybody likes Starbucks pumpkin spice latte, which I don't know why, but they're super sugary, but they're like, hey, I got you one, right? The most recent one is they are sending QR codes in the mail. So you're like, oh, shoot, Ricoh got me something cool. And I scan it. It's a redirect link that shoots over to maybe an Outlook or a Gmail. Says, hey, I need you to enter credentials here. Or it's one of those links where it's going to redirect you to, Keystroke Logger or something like that. And that's the weird part, is that you have to be very mindful of these things, even in everyday life. So common threats and how to outsmart them, okay? So phishing, again, phishing is the #1 point of entry. Ransom. Now, ransom, in a good, bad way, right? This is my bread and butter. You have reverse malware because that's how it's usually delivered, encryption, and also ransom. Chances are, whenever you see the ransom note, it's already over. That means the threat actor has left behind this beautiful, lovely note, which is in a raw text edit file. It looks like garbage. And it says, hey, we have your data, either pay to play or whatever. I've seen small hospitals completely turn a blind eye and say, we'll deal with it later. We really don't care, right? Which is pretty wild, and which is a wild, abrasive move. I don't recommend that. You have to do something, because in dealing with ransom, we have these organizations like the OIG, OGA, and different Office of Civil Rights and whatnot that come around and they say, hey, we have questions now. And what they're doing is assessing whether you have the right skill set, the right tools, the right budget, right people and process and procedures in place to combat ransomware. And if you don't, you're going to be held liable, or the organization will be held liable. I'm going to give you an example here, okay? One, we've had I worked out a case once where, I'll give you two examples. One, where an organization was like, hey, we really don't care. It was a small chiropractic office in Phoenix, Arizona. They knew they got breached. The ransom threat actors call them and like, hey, pay us or else, or we're going to the FBI for you. And that's very kind of him, right? And what happened is it was pretty wild because the attorney that we were working with there, they were like, forget it, we'll deal with the aftermath. And it's like, dude, do the right thing. Do the right thing by the right people for the people. And these are, chiropractic patients, elderly, people who are injured and whatnot. And the attorney was like, I don't really care. Just how much is going to cost me? That's not the right approach. On the other side, we're working on a massive cyber breach in the state of Tennessee where the CEO made a decision, say, hey, bring in the attorneys, bring in the IR firm, forensics, IT, everybody come together. This is how we're going to move things forward here. How we're going to recover, how we're going to get back in operational management and whatnot. And they took responsibility. Now, it did cost them. It cost them about $400,000, about $500,000 in fees, legal fees, and settlements, right? But if they would have done nothing, the U.S. federal government or OIG or other civil rights Office of Civil Rights would have came down on them pretty hard, and one, made them invest millions of dollars in cybersecurity, and number two, would have made them pay penalties and fines. So that's something to consider here, right? So the usual suspects in this factor are ransomware. So when I was working a time in Phoenix, Arizona, I had to go to Tucson to go to an intensive care unit to kind of do an audit, right? Again, I'm a super technical guy doing an audit. I'm in the emergency room, the ICU, and it just goes dark, and I'm like, oh no! And it's the ransomware of, hey, we have your files, pay up or say goodbye. At that point, I had to go into ransomware negotiation, right? Ransom negotiation. Reaching out to threat actors, calling them, and also emailing them, hey, how much money do you want? Thankfully, that hospital actually paid, I think it was about $50,000 to get their data back. But here's a kicker. Whenever the ransom threat actors give your data back, it's orphan data. It's just data everywhere. It's in the raw text file, so it does you no good. So the question you want to ask yourself in this one right here is, do you pay or not pay? And it's okay not to pay, right? When it comes to phishing, remember, your IT department does not need your login. Chances are they have their own admin password. They should have their own password or a .a account, a secondary account, to do what they need to do to get in your environment, okay? Now, there's a thing called insider threat, and I believe this is a big money maker as a job and also as a profession and along with as a business. If you can quantify and qualify doing insider threat, like building these UBAs, user behavioral analytics cases, right? I think you're onto something here and you would make quite a bit of money. Insider threat, you have different use cases, but you have the top 5 that go in there. And Bob is one, we're just using a guy named Bob, for instance here, does not need to use the same password over and over. And that right there is an insider threat. Password complexity, okay? And the overuses of aging and also replication and also repeat usage of passwords is an insider threat. And the insider threat himself in this instance will be Bob, and Bob happened to work in IT, okay? And that's called shadow IT. Anybody who's worked in IT, I worked in IT. I'll give you an example. I was making pretty good money doing DoD contracting, and I took my first job as an IT person, and I went extremely low my salary, where I had to get 3 or 4 jobs, but I knew I had to do that, right? The moral of the story is that working in IT, there's always workarounds, and unfortunately, IT companies, IT departments, and people become a target of insider threat. And that's okay, because if you're not doing anything bad, if you're not doing anything harmful, then it's okay to be insider threat as long as you're not doing anything bad, right? You might meet the categorization, but it's all right. The other ones are like executive, right? A lot of executives do insider threat stuff, moving money, money laundering, extortion, and stuff like that. And then the other one is a disgruntled employee. And the reason I bring these use cases up for insider threat is if anybody is ever interested in doing insider threat, as long as you understand those 5 use cases, everything else trickles down and helps out, right? One of the things I always tell people is treat every email like a suspicious profile. If it looks too good to be true, chances are. And we're talking about a dating profile, okay? So if anybody's ever been on Tinder or, Bumble or any of those dating apps and they have this really good looking person, you're like, man, that's a really good looking person. And you're like, this is something's pretty interesting there. Chances are you have to treat it as if it's very suspicious and you're probably going to get catfished, i.e. the phishing. Same thing, same premise applies with the overall concept of phishing itself. If this email looks well crafted and it comes from Ricoh, says I got you a gift card at Amazon, chances are it's probably a phishing email. So some of the things we have to be very mindful of when it comes to cyber hygiene and also healthcare heroes, right? Scrubs, in fact, the security aspects of it in the security success. Cyber hygiene, I believe, is much like working out or boxing, right? I box every day, I work out every day, and this is a rhythm of life that you need to do. So same thing with cyber hygiene. What are your ACLs in place, access controls? Who is identifying these people, IAM, right? That's a really good career field to be in, by the way. And then additionally, like, what are you doing to protect yourself, right? When it comes to multi-factor authentication, one of the things I'll tell you is like DoD, they do a very aggressive things. That means you have to enter your password, you have to credential, and you have to put your CAT card in, and then you have to authenticate, and then you get to the application, and you have to do it all over again. If you ask me, that's a bit too much, but I get it. The Department of Defense has to do that for multi-factor authentication. To me, for working from an incident perspective, that's too many logs to surf through, and that'll just extend the incident response, right? The other thing I'll tell you is I'm big on training, security training, and also jiu-jitsu, boxing, and also fitness, right? You gotta train regularly. And that means in training is also considered an aspect of you training other people, okay? That means you can go out there and you can train other people, because repetition, much like a speed bag, right? You're in the speed bag, is all about training, and that jogs the memory of like, oh, these kinetic energy and also kinetic connotation of the subject matter expert, right? So one of the things I'll tell you is just keep on training. The other thing is, if you can do this, again, there's a lot of flat networks out there. If you can do network segmentation, okay? If you can, that means completely divert each network. So if you have a hospital, right? We have a hospital. You have the corporate network where all the medical devices are on, and even in that corporate device, even in that corporate network, you should have different VLANs where medical devices are, vendor devices are, and devices such as computers, servers, printers, and whatnot. And you have 3 different VLANs. And then you have another completely different network for client access, like guest network and whatnot, and then people who just show up. Because one thing I've realized that when you take your wife or you take your spouse or your husband or your kids, are like, where's the Wi-Fi? And it's like, well, we're not going to a hotel, we're going to a hospital. So calm down, right? But if you, as an administrator of the infrastructure, IT, and whatnot, if you can silo those things out, I think that'll be great, and you'll have at least a layer of segmentation. Okay. So good cyber hygiene isn't about hand sanitization, it's about sanitizing your system. Okay. And the reason that's kind of funny is because a lot of people, when I talk to executives, remember, we're all at the technical level here. When I talk to executives, they're like, well, hey, Ricoh, why do we need to do hygiene? I mean, everyone's showers around here. I'm like, no, guys. Like, hygiene, that means we're fit to fight. We're professional. We're good. We have all these different things going on. Okay. So as we move it forward, and I know we're coming up on time here. We got about 20-something minutes, and we'll start taking some questions in a little bit. The prescription for success, right? How do we keep people on the outside? How do we keep hackers on the outside while saving lives? Okay, and I'm not a GRC person. I do have a compliance background. I do have an audit background. But this is where I think the big win for people who are not technical, who want to get into cybersecurity and want to learn without being super technical, is conductive risk assessment, right? And I know everyone's like, oh, that's so painful and whatever, but really think about it, right? One, in your line of business, you're going to have to do a risk assessment, right? You might be the practitioner, the wrench turner, but then there's going to be an owner like a CISO or CEO, a CFO or something like that. But this actually helps you understand the vulnerabilities, where the threat actors want to target, and actually where they want hackers, where they want to go. Because if you really think about it, like, hey, we have these EC2 instances or these Azure environments, what's the risk around them, right? And you start looking at the ALCs, access control lists, WAFs, you look at what's protecting them, what's logging them, what's monitoring. Let's just say you have nothing on this right here. That's a huge risk to the organization. And then on top of that, you're dumping a bunch of PHI, PI in there. That's pretty wild, right? So you have this factor of like huge risk, and you say, hey, so and so, can you help me out identify the risk and who's going to own it? Because you as a security professional should not be really owning any risk. You should be designating the risk to other people, like, hey, John, you own this server, here's your risk, right? Hey, so-and-so, Dr. So-and-so, you stood up the server, or you have a laptop full of PHI. This is not my device, this is your device, so here you go, right? The other thing I'll tell you is, and we've seen this in supply chain attacks, third-party attacks, fourth-party and ninth-party attacks, which is very, very down the rabbit hole, right? Update your software, update. When I was working for McDonald's a long time, and I know you were saying, it's like, wait, McDonald's makes burgers. Well, actually, McDonald's has a huge security, cybersecurity footprint. They have great people over there, great men and women over there on the cybersecurity, and they're global. This is a global enterprise. Really think about it. Then I remember we were working this deal once, and and a server popped up, and I was like, oh, it got popped. I'm like, okay, let's take a look. And it was a Windows XP, and it was in South Africa, and I was like, holy moly, we're the biggest burger maker in the world, and Windows XP is already over here. I was like, come on. And the reason I did that is because one, it was a private franchise, and number two, like, it was just a McDonald's. People really don't think about McDonald's and security. They just want their burger and go. So same with the franchise over there. And this is nothing to be negatively said about them. It's just more so, it is what it is, right? Again, this whole factor of doctors doing what they do best, and they forget about everything else. And same with McDonald's and this other organization, like, they're just doing what they do best, and they forgot about that, right? The other thing is this, is investing in incident response. Hoping we don't get breached, or hoping your organization doesn't get breached, is not a factor anymore. It's a matter of when. So if you want to invest, and again, investment doesn't necessarily mean money. It can say investment can come in labor resources, or tools, or even just time and labor, okay, or equity, okay? You can take yourself and you can say, hey, we need to invest into an incident response plan. Does everybody know the shooters in the world? Does everybody know who's hitting on first base? Does everybody know who's taking charge? Blah, blah, blah. Because to be honest with you, a lot of organizations, they say they have it, but they've never practiced it. And if I'm somebody who wants a quick win, I'm going to go ahead and do this right here. So, at the end of the day, cybersecurity in healthcare, just because one thing should be the heart monitor, is not ransomware notification, okay? And what I mean by that is, patient first, right? In healthcare, it's always about patient first. It's never really about, hey, what about the ransomware attack, right? So you have to make that as visible, or bigger than visible, as you can, okay? At the end of the day, the call to action, as we move forward and we're closing up here, one of the things we have to be very mindful of, secure patient data, okay? And you have to trust that we as cybersecurity professionals, Ricoh Danielson is out there trying to lead the march to protect lives. Our data is our life, and it's our responsibility as cybersecurity professionals to ensure that we're protecting other people. So let's move into the questions if you guys want to.
Thank you, Ricoh, for delivering such an informative session, and our attendees share the same sentiments. If you're interested to learn more about our program, do let us know in the poll that's going to be conducted now. If you would like to learn more, please select yes, and we will schedule a call to provide you with more information. An important note, admissions are presently open. For comprehensive details regarding our courses, kindly visit our official website, www.eccu.edu. So, Ricoh, shall we start with the Q&A?
Let's rock and roll. Let's do it.
Sure.
All
right. Our first question to you is, what is the minimum requirement to become GDPR compliant?
Ooh, that's good question. So there's minimum requirements, and then there is indirect minimum requirements, right? So GDPR is one of those European frameworks of risk analysis and also vendor management and also security framework. What I would do is, remember, it's just a guidance and framework. Some of the stuff is going to apply to you, some of it won't. So I would take all that stuff out there. There's a lot of overlap from the NIST 853. I would take all that information, kind of say, okay, what applies to my business and what doesn't, right? I'm going to give you an example. A lot of hospitals still have in-house data centers, right? And they're within, and the cloud component of, GDPR or NIST is just not there, right? However, the notification upon breach is there. So you have to figure out what's more important to you, what aligns with your business, and what are you responsible for, right? The best things you can do is, kind of get with a consultant or somebody who kind of understands GDPR and say, okay, what am I being held to here, right?
Thank you, Rico, for answering that question.
Of course.
Our next question to you is how to know if there is a ransomware attack, to prevent, what steps we use, and what's the ransomware attack file extension?
Sure. Okay, so at this point, we're gonna have to go into threat hunting, right? So you're gonna need to have some sort of EDR, XDR, MDR in place. If you do that the old school way, oh, here we go. Sorry about that. Let me go ahead and pull my screen back up, guys, if you don't mind. All right. Okay, can you guys see my screen now? Okay, perfect. Okay,
Yes,
so
yes.
when it comes to going out there and finding out the ransomware and whatnot, what I would say is you need to start doing some threat hunting. Okay, so you have this MITRE ATT&CK framework. You look at the different areas of infiltration. I would start with the most recent one. The first one is reconnaissance. So you're like, okay, how are we being recon? What's our digital footprint outward, external facing outward? And is anybody scanning us? Something like a like a Shodan or like a Burp Suite would help you out do that. Those different tools. I would take those different elements. Now, whatever your vertical is, whether it's healthcare, whether it's financial or whatever, I would look at the main top 5 or top 10 threat actors and understand what they're using as an IOC, indicators of compromise. It might be a vulnerability, it might be certain targeting, like Citrix servers, or it might be something of that matter, right? And then I will take those things and say, okay, do I have these in my environment? If I do, what are my remediation processes here? Do I need to do placing any blocking of any known bad threat actors, right? The other one would be like, if we can find the ransom threat acting group that put ransom.exe, okay, cool. What does that look like? Get those hashes, start doing a discovery search and see what's in there, right? At the end of the day, you're gonna probably need a tool like like an EDR of some sort. So I hope that answers. That's a really good question.
Thank you so much, Rico, and thank you for answering that question. Next question to you is, what does it feel like to work as a cybersecurity expert in healthcare? What is a typical day like?
Very stressful. I'm joking. One of the things I will tell you is it's not necessarily stressful. It's a matter of you have to have a lot of buy-in. You have to have a lot of different information, doing different things. And also, if you're working in a healthcare environment, security generally winds up being the lower part of the interest, and also for the budget. If you really think about it, less than 1% of budgets are designated for IT, and less than 50% of that 1% is for security. So you might be alone. You might have to seek outside counsel, like other people like this right here. You are going to have to be the thought innovator and the spearhead and the tip of the spear to do certain things. At the end of the day, it might be kind of daunting, and so you have to take some personal time and kind of refresh yourself. This is why I work out all the time, to get those thoughts going and whatnot. But at the end of the day, like, you might be the only person really thinking about the tip of the spear and being the security for the organization. So yeah.
Thank you for answering that question. Our next question to you is there the best method to prevent systems from hacking and create another user on system?
Okay, lateral movement. Yeah. So take the internet down. No, I'm joking. What I would say is, in order for you to prevent lateral movement, you might want to limit LSAS, right, or PowerShell. That's kind of the go-to of what a lot of threat actors use. So what I would say is create different OUs or different groups that will allow certain people to use PowerShell, and more specifically, only admin users to use LSAS. Usually that's how that, and then on top of that, I would go ahead and roll credentials every 30 to 60 to 90 days, every quarter if you can at a minimum, and the complexity and whatnot. So that'll help prevent lateral movement.
Thank you for answering that question, Rico. Our next question to you is, what is the critical cybersecurity incident you handled in healthcare till date?
That was a pretty big one. Can't give you the specific name, but it was a downed hospital that went down for 84 hours. We rebuilt the network within 84 hours, and then it was over 1,100 devices that needed to be re-imaged within 24 hours. So it was a very late night and very hard to do. And then another one was a ransomware negotiation where they stole hundreds of millions of medical devices or information, and then we did the ransomware negotiation, and they were asking for $10 million, and we negotiated down to, I think, right about under $1 million.
Thank you for answering that question. Our next question to you is, can you please give more insight on GRC with respect to technical and non-technical skills?
Yeah, so GRC, I think it's a good place for people who either are really passionate about GRC, like auditing compliance, which is cool, or people who are about to get into cybersecurity and don't know where they need to go just yet. And I think it's really good for both of those. And the reason I say that is because GRC is you have to know the business in order to govern risk and make sure the compliance of it, right? And the other aspect of it is, that's going to get you the education that you need to become more technical in those facets. If I'm a person who's just starting out, I'm probably going to go to that. A lot of military people that I work with, especially retired, officers and whatnot, they've been in policy, they've been doing procedures for so long. I would say, go do that for a year or two, get your chops. In the meantime, get a really technical skill set. And right now, there's in HITRUST, there's I think 19 domains, right? What I would tell you is choose one of those and become very effective and very efficient at that. And then you'll be surprised because they're like, hey, that dude used to be an auditor. I know a CISO of one of the world's biggest banks, and he was an auditor and not a technical person. And by the attrition of him moving up in the world, boom, there you go, became something amazing.
Thank you, Rico, for answering that question. Our next question to you is, today, AI generation is there, and any AI help to prevent ransomware attack?
Yeah, so a lot of EDRs, XDRs, and MDRs, they actually have a artificial intelligence library that is used quite a bit. And it's like, hey, here are the most anomaly attacks. Here's their IOCs and TTPs. Here's some remediation recommendations. I just demoed a cloud tool yesterday that had artificial intelligence and can do predictive analysis, saying, based upon your cloud environment, more than likely you'll be subject to these type of attacks, and here's the things to do. So artificial intelligence, I believe, is not going to take anybody's job. It's going to enhance jobs to be more effective and more efficient. Think about this. Much like the internet, right? Artificial intelligence moved in a 7-year gap, right? Because it's learning itself, and every 7 years you're going to get a major innovation. So I would just take it as a win, taking the strides, use artificial intelligence to show that you're a true rock star.
Thank you, Rico, for answering that question. We have a lot of questions received, by the way.
Okay.
So our next question to you is it wrong to be the DPO and be the implementer at the same time?
It is not wrong. I'll just tell you right now, give me 1 second. It is not wrong to be the DPO and also anything like that. What that tells me, you have a budgetary confinement. At some point, you're going to have a path is going to have to be chosen, whether it's you do this or do that. If you're doing both, that means you just have a budget issue, and you probably need to go back to the business and say, hey, look, I'm a data protection officer. I'm also doing this. I need some help. So either you're going to get some people underneath you, or you're going to hire, or you're going to separate. You're going to be doing DPO, and another person's going to be brought into this. I've been caught in that situation a few times, and here's what I can tell you is, one, remove your ego, because you can't do everything. Remember, it takes an army to conquer a country. It takes a team to win a basketball game, right, and a football game. If you're leading, go lead, okay? But that's not wrong. However, I can tell you that it's very daunting. It's very like, oh, tough business. I'm tired, right? So pace yourself. Pace. Remember, this is a marathon, okay?
Thank you, Rico, for answering that question. Our next question to you is, with healthcare sector, hospitals, clinics exploring Gen AI for their clinical practice, what are the cybersecurity consideration and precaution that we need to be concerned about as a clinician non-IT person?
Okay, yeah. So when we talk about Gen AI and also just AI in general, just remember it's going to automate itself and actually relearn itself. So the best things you can do is actually containerize itself, so it's not calling out to different facets and different API calls and different other machine learning or artificial intelligence. Remember this. I believe that artificial intelligence should be used in cybersecurity, and I believe that artificial intelligence should very well be used in medical, so it can learn and create its new provisional stuff. If you can containerize it and secure it around its own self, right? Imagine having the smartest engine world child person in the world and be like, here's your guardrails and you're right here. Put some governance around that, some compliance around that, and I think you'll be very successful in that.
Thank you for answering that question, Rico. Our next question to you is it advisable to have OT security specialist in addition to IT and cybersecurity specialist?
Well, it really depends on your business model. I've seen some organizations do the shared resource model. Sometimes it works, right? Where you have IT and security. But the question I got to ask you is, does it fit your business model? Is this with the way the business is going? Because some organizations just don't have the budget or the want to have an IT and security. Usually, whenever you have IT infrastructure and security, and security over here, is when you're probably about $100 million in revenue, and you can afford that. If you have an IT person straddling both sides of IT and security, what that tells me is a very small organization, and you might want to figure out how you can get more money coming in to divide and conquer.
Thank you for answering that question, Rico. Our next question to you is, a server is the most important thing in any organization. So what are the steps to prevent the server from hacking? How to secure a server?
Sure. That's an interesting way of looking at a server. Is one of the most viable. It could be, right? Sometimes a server is just a junction server, which just performs a function and does something else. I would take it a step further and be like, okay, what does this server have on it? Does it have database storage and whatnot? Let's just say you have an AWS with a S3 bucket and whatnot. To me, in order for you to do that is visibility. If you can't see, you can't shoot, you can't hit it. So that means, is it only whitelisted to specific areas? And then number two is accessibility. Who has access to this? If everybody has access to it and it's a forward-facing thing and it's just out there in the public, then you got a problem, right? But if you can limit the access and then also the visibility of it, along with multi-factor authentication of authenticating who's going to it, I think you'll be all right.
Thank you, Rico, for answering that question. Our next question to you is, are there any specific cyber security skills to work in healthcare?
Yeah, so one, have a general idea of security. Number two, have a general idea of IT. And number three, what I would say is understand your business, because each hospital, each clinic is different. A cancer treatment hospital is way different than a general practice clinical urgent care, right? Two different things, right? And then on top of that, know what's inside the hospital. I'll tell you right now, I've worked in hospitals a very long time. When I was working for one of the biggest ones in Phoenix, Arizona, I had over 1,000 medical devices that I had to know very affluently. And I was like, dude, how do you do cybersecurity around an ENT, ear, nose, and throat device? Like, what's going on? Or how do you do cybersecurity around an ophthalmologist, like an eye device? Like, it's very weird. It's very different. But sit down with your business and say, okay, what do we do here? What are the top things? Where's our most critical data? And then what is really important to the business? Like, is it the devices? Is it servers, S3 buckets, stuff like that?
Thank you, Rico, for answering that question.
Yeah.
Next question to you is, I am a fresher and work as cybersecurity engineer. I have knowledge in VAPT and pen testing. I want to learn more into GRC domain. So first, where can I start? And second, what should I learn in starting?
So you're going the opposite route, right? So you're more technical person. So what I would say is, look at the policy. Either you've written it or somebody's written it for you, or it's already been there. Look at the policy, and then there should be a procedure to go with it. Like, how do you do things, right? And then kind of measure those things. Say, okay, all right. So we have these two different things, and understand what you're going to be held to in the level of responsibility as the practitioner, right? Technical and whatnot. These things should be prescriptive of how you're going to do the job. Now, you doing the job, you're like, that's not the reality situation, and you just have to marry those two things. It's not hard as you think it is. I think it's a matter of just cross-referencing, and also get with your compliance person, right? Compliance persons and also auditors are often left on the outside because they're seen as a nuisance, like, oh, whatever. If you can bridge that gap, I'm telling you right now, you're going to have a great, amazing relationship and also business forward.
Thank you, Rico, for answering that question. Our next question to you is, how cybersecurity threats and defensive strategies emphasizing the protection of electronic healthcare records?
I'm sorry, so what was the question again?
How cybersecurity threats and defensive strategies emphasize the protection of electronic health records.
Yeah, so if I understand the question correctly, how are these threats kind of modeling and making and also cultivating cybersecurity? The great thing about threat actors and hackers and threat activist groups and ransom gang is they're always innovating different ways to get in our systems and cause havoc. And that's actually shaping how we're going to approach these different things, our strategy, right? What worked 2 years ago is just not going to work this year. I think in 2025, 2026, we will see more than likely the biggest influx of polymorphic and metamorphic ransomware that self-propels itself, and that's going to cause a new way, a new strategy of how to mitigate these threats.
Thank you for answering that question. We'll take last two questions for the day, Rico.
Sure.
So our next question to you is, how do we manage cybersecurity in healthcare, protecting patient data and medical systems?
Yeah, so when we kind of go back to the whole thing is like, what's important to the business? Is functionality and uptime and downtime more important than security? Those are the questions I would ask. And then where's our most crown jewels? Where's the most biggest things that we need to protect, and how can we protect them? I would start at those two facets, and that'll kind of dictate forward.
Thank you for answering that question. Our last question to you is, what shortcomings do you observe in the field when these protections are extended to local practices?
Investment. A lot of doctors do not see the value add in investment of security, especially at local practices. Think about it, a doctor, nurse practitioner, anesthesiologist is more worried about patients and how many they can see. Because remember, the more patients they can see and the bigger procedure or medical, whatever it is they're treating, the more money they're going to get. So their focus and attention is on that. So whenever we worked at certain breaches and whatnot, it was pretty fascinating to see, these doctors who are making $100 million a year, maybe $200 million a year, are not properly investing into the security attributes that are needed. So kind of disheartening, but I get it.
Thank you so much, Rico, for answering those questions and for the great presentation and knowledge shared with our global audiences. It was a pleasure to have you with us, and we are looking for more and more sessions with you. Before we conclude the webinar, Rico, would you like to give a small message to our audience?
Yeah, small message. Check this out, guys. One, cybersecurity is an ever-growing thing, so grow with it. Number two, make friends. I've seen so many people in cybersecurity like, I'm right and blah, blah, blah. Just be mindful of each other, treat each other very respectfully. And number two, just remember this, cybersecurity work, it will always be there, always. I don't care what anybody says, it'll always be there. So there's so much work that every one of us has an opportunity to lead forward and do some great things in cybersecurity.
Thank you so much, Ricoh, for the message to our audience.
Yeah.